Thank you very much for having me here today. I'm very excited to be a part of the Getting a Grip program. My name is Deanna Derhovzel. I'm going to be introducing to you today the PACE Canada materials and protocol, which I'm very excited about. I also use these materials in my practice. I'm a clinical psychologist in supervised practice working here in Ottawa. Some of the clients that I see, I help them with motivating them to improve their lifestyle. I work with children and adults to do this. So what is PACE? It's a guide to help you counsel others on physical activity and nutrition. And it was originated in the United States at the San Diego State University with Salas and colleagues. And it stands for Provider-Based Assessment and Counseling for Exercise. And it was brought here to Canada by the CFLRI, the Canadian Fitness and Lifestyle Research Institute. So why use it? Well, it's a protocol that's been established to help guide you counsel others on lifestyle behaviors. It's quick. It takes about 5 minutes for each of the health behaviors. And most importantly, it's grounded in research and theory. So it uses empirically validated behavioral change models, particularly Prochaska's stages of change model. So before getting started on talking about the protocol and the materials that we're going to use, I wanted to give you some background about the stages of change model. When I was first learning how to do motivational interviewing for healthy change, I found this model to be very useful, and I think you will too. So basically it assumes that people move through 5 different stages as they change their health behavior. And this movement is dynamic. People move through the stages, but they'll also revert back to earlier stages and cycle through sometimes before that behavior becomes a habit. I also wanted to talk about some other constructs of the model. I'll talk about stages of change, but also some of the mediators of change. So these are factors that affect how people actually move through the stages of change, and that's decisional balance, self-efficacy, and barriers. And I'm also going to talk about the 10 processes of change that they outline, which are different activities and experiences that people undergo depending on what stage they're at. So stage of change basically assesses someone's readiness to change. There's pre-contemplators, so these are people who are not even thinking about change. Contemplators, those who are thinking about change, but they haven't made a decision to do so, and they haven't made steps yet. Preparation, those who have decided that they'd like to change. They're experimenting with the behavior, but they haven't actually made the change fully. Action, they've started doing the health behavior, but they haven't done so for more than 6 months. And then maintenance, they've been doing the behavior for more than 6 months. So again, people move from pre-contemplation to maintenance, but they also will, at times, which is a very normal part of the process of change, revert back to earlier stages. And that's often at pre-contemplation. Most people that you see tend to be in pre-contemplation stage, and sometimes people get stuck there for quite a while. And I also wanted to mention that you could be at a different stage of change depending on your health behavior. For example, you could be at pre-contemplation for being more active, but you could be in the action stage for healthy eating. So decisional balance, this is one of my favorite constructs of the model. It's basically the relative balance between the pros and cons of doing the health behavior. So the idea is if the pros outweigh the cons, you would be doing the health behavior. And on the other hand, if the cons outweighed the pros, you wouldn't be engaging in the behavior. So cons would be the barriers, the risks, some of the temptations, the costs of doing the health behavior. And the pros would be the benefits and the things that you like about doing the health behavior. And I like this construct because it really helps as a health professional or as someone who's counseling somebody else the irrationality of health behaviors. Often we know that we want to change, we know it's healthy for us, we want it, but we have struggles in terms of engaging in the health behavior on a regular basis. Often people say, what's wrong with me? I want to do it, but I'm having a hard time. So helping them understand the cons and the pros and really getting a sense of their experience will help you understand that in fact, there's some very powerful reasons why they're struggling. And it's always good as someone who's helping someone to assume that there's very good reasons why they're not engaging in the health behavior, even though they want to. Self-efficacy is another very important construct that describes how people move through the stages of change, and it's one's confidence in being able to do that particular health behavior. Over different times and over different situations. So whether that be through different seasons of the year when weather changes, or through holidays or business trips, keeping with healthy eating. This was taken from Bandura's social cognitive theory, and to enhance self-efficacy as a helper, you can often make encouraging remarks. You can help point out how the person has already made changes, and there's some other things that we'll talk about later on that you can do to help enhance someone's confidence. Finally, the processes of change, and we know that there's different experiences and activities that people will naturally undergo at each of the different stages. And this is important as an intervener who's trying to facilitate and promote healthy behavior change, because we really want to time our advice and suggestions well. We want to meet the person where they're at and help initiate some of these important processes. So for example, in the earlier stages, that might be asking questions or getting them to talk about certain topics. But at the later stages, when they're more ready to be in action, this would be giving more specific advice about behavioral changes they can make, manipulating their environment so that it's easier for them to choose the health behavior. So that's a brief overview of the Prochaska Stages of Change model. I'm now going to talk to you about the binder and the materials. So if you could just get your binder, you'll notice at the beginning there's a sheet that gives you the website address of PACE, and on this website you can purchase electronic forms at a reduced cost that include all these materials. Then you'll see an outline that describes what materials are in the binder and different sections. So first you'll see an overview with a flow chart describing the protocol, the steps that are to be taken. The first side is physical activity, and the second side, nutrition. The second page here is a checklist of what you will do when you're sitting down counseling the patient. And again, the first side is physical activity, the next side, nutrition. The second section is the assessment, and this is where you'll see two assessment booklets, one for physical activity and one for nutrition. This first one here is titled, What's Your Pace? And the second, What's Your Plate? So that's for the nutrition. And I'll explain those in more detail soon. The next section gives you some instructions and guidelines on how to counsel those who are older or females who are pregnant. And I'll talk about that a little bit more later. The next part is the follow-up and record-keeping section, and it just has a sheet here where you can record important information the time that you're following up, so that you can continue keeping things on track when you follow up with them a second time. And then additional resources. There's some handouts here that are very helpful on nutrition. There's some references and resources for patients, and at the back I think there's some contact information as well for different organizations. And in some of the pockets you'll see that there's a Canadian food guide, as well as a Canadian fitness activity, physical activity guide for the different age groups. Okay, so I'll get you to turn to the first section where it has the flow chart. So the first step would be to select who you're going to counsel, and of course inform them about a little bit more about the procedure, that you'll be asking them to fill out an assessment form before seeing them, and that you're going to arrange a follow-up. Second, administering the assessment. So this would be done by office staff maybe, or they can do it at home or before they're meeting with you. And this is basically getting them to fill out the booklet. This third part there talks about the counseling part of the protocol, and it talks about the different procedures used depending on what stage of change they're at. And then finally, it talks about follow-up, which is a key part of the intervention. Okay, so the next part here talks about the checklist that follows the protocol. These are things to do while you're counseling the patient. So the first step would be to review in front of the patient what they've written in their booklet and clarify anything that you don't understand. And then administer any appropriate interventions at this point. And I will get into this in more detail, and this depends on what stage of change they're at. Then you would discuss and agree upon a plan or a goal that they might have set. And then to write that down in a provider-only section that's in the assessment book and use your signature there. And then the last step would be, after arranging a follow-up appointment, would be to photocopy that protocol, the assessment booklet, and give them a copy so they can take that home, and you also have a copy for your records. Okay, so I'm going to get you to find the first assessment booklet, the one for physical activity, and I'm going to talk about what's in that booklet. So if you flip to the first page, you'll see a PARQ questionnaire, and basically what this is a questionnaire that assesses someone's physical readiness to engage in physical activity, and it's a widely used measure for those who are between the ages of 15 and 69, and it basically asks them to indicate if there's any medical conditions that would put them at risk. So if you see if there's any boxes under the yes column that are marked, that's a good indication that they may need a tolerance test before being ready to engage in activity, and that they should consult their doctor. Now I just want to speak briefly about assessing the risk factors for those in special populations. So those who are older, there's a flow chart here that helps you determine their risk for cardiovascular event. And there's also a PharmX, abbreviated form of the PharmX questionnaire for those women who are pregnant to help you assess their readiness for physical activity. And again, if there's any red flags, here would be the time to get them to consult with their doctor. Okay, now the second page here, I want to explain, it's titled, What's Your Pace? Now you'll see on the bottom there's a multiple choice question, and there's 3 different options, and these are the different stages of change. This will help you assess what stage they're at. And if you'll notice, there's only 3 rather than 5, which is the amount that Prochaska's model has. And this is pasted this because they wanted to simplify and make it more user-friendly. So depending on what stage of change they indicate, they would go to a different page. So the first one, page 3, second, page 4, third, page 5. Now before this, they're to indicate how active they are right now. And this will help you with goal setting. So it asks you the type of activity, the duration, and how frequently they're doing that activity, how many days a week. So it asks about light activity, like gardening, moderate activity, like dancing, and vigorous, like running. And it also asks how often they're doing activities that improve their flexibility, like bending and stretching, and how often they're doing activities that help them improve their strength and balance, so pushing and lifting. Now I'm going to switch over and talk about the nutrition assessment sheet. So next I'd like you to turn to the Rate Your Plate assessment booklet, and you'll see on the first page it's similar to the activity assessment booklet. You'll see at the bottom there's a multiple choice question, again asking what stage of change the person's at, and of course like the other booklet, depending on what they choose, they're to go to either page 3, 4, or 5. And at the top here, it asks them what their nutritional behavior is like. Specifically, it asks whether or not they're eating the recommended amount of servings in each of the 4 food groups. There's another question asking how often they choose lower fat foods, and also a question asking what weight category they're in, either overweight, underweight, or neither. So on the second page here, I'll let you to turn to page 3, Rethinking Your Lifestyle. And I'm going to explain using this flow chart how the PACE stages compare to the Prochaska's 5 stages of change. So the first stage is identical, pre-contemplators, those who are not even thinking about change. And the goal here would be to help them think about change, not to actually engage in the health behavior, but just getting them to talk about and starting a dialogue about their situation. So here the sheet lists a number of benefits of engaging in the health behavior. So on this particular booklet, it talks about the benefits of healthy eating, and they're to indicate which of these are important to them. And you'll see there's the provider's use only box at the bottom where you're to sign and date. On the 4th page, planning the first step. This is equivalent to the contemplation and preparation stages of Prochaska's model. And here people are thinking about change and perhaps already starting the planning of that change. So it asks a number of questions to help you counsel the benefits for healthy eating, a particular health behavior that they're willing to change, whether that's eating breakfast in the mornings, when they're willing to start this change, what they think might get in their way, what would make it easier, and a question about social supports. So the goal here would be to help them with this plan, help them come up with some first initial steps. The 5th page, Keeping the Pace, is equivalent to the action and maintenance stages of Prochaska's model. And this is where people are actually doing the behavior. Either they've maintained it for some time or they've just begun. And here there's some questions to help you with counseling as well. The goal being to reinforce what they're already doing well. So it asks you questions about what has interrupted them in the past, what got them back on track, what else they could have done, how confident they are, and some plans that they might have in terms of coming up to any roadblocks in the future. So that's the 5 pages of the booklet that describes the stage of change. But before I talk about specific tips in counseling people in these different stages, I'm going to go over some guidelines on counseling others in general, no matter what stage they're at. So you'll see here the first point says provide specific advice. So it's always helpful to be specific in terms of what you're saying, as opposed to giving sort of vague statements about being more active or eating better. The second one there is helping them set realistic goals. So for example, if they've never exercised before, this would be a good time to talk about increasing moderate activity as opposed to, say, vigorous. Addressing interpretations of pros and cons. So the decisional balance construct here is important at all stages. And really, when they say, I just don't feel like it, something like that, it's helpful to really get them to talk a little bit more what they mean. Is it because they're fatigued? Is it because there's competing things in their environment or social relationships that are pulling them in another direction? Getting more of a sense of their personal situation. Helping the client understand and problem solve around the barriers that they indicate, whether they're perceived or real. This is something, again, you do at all stages, is talk about what gets in their way, because even maintainers, they have trouble. They have barriers, life changes, things come up. So it's important to talk about this at all stages. Of course, providing empathy, communicating that you're listening to them and understanding their personal situation, and lots of positive reinforcement. And this is really important in enhancing self-efficacy and their commitment to change. And enhancing their sense of control. And one way you can do this is point out sort of what they've already done, the things that they've done to manipulate their environment or to encourage supportive social relationships, that they do have some control in terms of helping themselves make it easier for them to choose activity or nutrition, healthy nutrition. The next slide talks about some pointers in terms of helping them set appropriate goals. So the first one I mentioned, making sure that these are obtainable for them and acceptable. The next one is important, sort of making sure that when helping set goals with someone that they're low cost, convenient, and flexible. So for example, when we talk about physical activity, as opposed to talking about it as an exercise session that they have to schedule in their time, into their schedule, like going to the gym or sporting activities, we can talk about it more in the sense of including it in their lifestyle. So getting off a bus stop or two early, parking farther away, walking, that sort of thing. With nutrition, that might be talking about things that they can pack with them. Last, goals that don't require special skills or equipment is important when setting realistic goals. So walking is a good example that most everyone can do. For nutrition, that might be talking about easy ways to read the labels on foods, or talking about the food guide, as opposed to getting into what's sometimes complicated, the percentage fat versus carbs versus proteins. It can be complicated, so just keeping it simple is helpful. Some don'ts to think about. The first one I talked about. The second here is only advising that it's simply good or bad for your health. People know what's good for the health. We all know that, well, most of us know that being active is healthy, and most of us know that eating less calorie-dense foods is good for our health. That's not usually the issue. There's powerful environmental factors and social relationships that often pull us in other directions. So it's important not to ignore those other parts of our environment and our situation that is really the issue, as opposed to knowing whether it's good or bad for our health. Focusing on willpower. That's a big one. Willpower is a myth, and when we think about motivation, we think of it in terms of action-specific, situation-specific events, as opposed to personality characteristics. And when I work with families, parents sometimes say, well, my kid's not motivated. And in fact, that's not true. They're often motivated for certain activities, like going out with their friends or certain TV programs, and perhaps not doing household chores. So really, it's when we talk about motivation, we talk about it in terms of a certain behavior, as opposed to a personality trait or flaw, which is not motivating at all to talk about. And of course, the last one, not doing a follow-up. This is a very important point, because we do know that following up is a key part of protocols in counseling others on physical activity and nutrition. Okay, now let's talk about what counseling tips are important for the different stages. So let's start with the first stage, pre-contemplators, those who aren't even thinking about change. I won't. The task here would be to help raise their awareness, get them to talk about their personal pros and cons, the benefits and barriers to the physical activity or nutrition behavior. And at this point, the important part is to listen and address any concerns that they have. So the goal, again, is not to get them to engage in more activity or change their behavior in any way, but instead to get them to think about engaging in that health behavior. So some tips here point out the pros and cons of healthy eating and physical activity. And I'm going to talk about some very important interpersonal style points that are very important throughout the process of counseling, no matter what stage they're at, but especially at this stage. So expressing empathy, I talked about that before. Accepting their ambivalence, that they have mixed feelings about engaging in the behavior. Taking a curious stand. So really your goal here is to take the stance of an observer or a scientist and just gather facts and information about them to help them and yourself understand their pros and cons better. And avoid argument or sort of debating whether or not that's a pro or a con at this point. Really, the idea is to go alongside and just help them understand themselves better. Second here, getting them to think and talk. How do you do that? Well, you can ask a lot of questions, focus on the why. So what are their beliefs, their knowledge, their attitudes about the health behavior? What is their environment like? What makes it difficult? What's their schedule like that relates to their health behavior, or their relationships that relate to the health behavior, whether they have demands on their time or they have someone who's supportive. And as you're talking to them, you'll get a sense of what some of these pros and cons are, and you can, as you're speaking, start writing down in words some of their pros and cons on this worksheet. So some of the good things about being active, it says here, or some of the hard things about being active. And you can give this sheet to them to take home, because they might come up with more ideas about what their pros and cons are. And you can talk about this at follow-up. And I think the sheet's really helpful at each of the stages, but especially this stage. And what I like to do when working with decisional balance sheets is point out that, hey, look, on the pro side, all the things that make it beneficial for you to be, say, active, like health benefits, feeling energetic, reducing pain, for example, these are things that are more future-oriented. You'll benefit from them in the future. Whereas the cons, a lot of them are things like feeling pain, or your heart rate beating fast and that bothering you, or sweating, things that are more in the moment, the here and now. So it's no wonder that you're having a hard time choosing the physical activity. It's hard to keep in mind some of those future-oriented goals, and as humans, we're very much guided by the moment. So this can help promote some empathy for your client. Okay. The next stage contemplators are people who are planning the first steps in making the change. The task here would be to reinforce that, yes, this is a good idea, and yes, you're right, these benefits are true. Helping them build self-confidence and helping them solidify that commitment, and collaborating with them to set achievable, appropriate goals. So here you discuss some of the initial steps and help provide ideas. So here, again, you'd be talking about the pros and cons, providing positive messages, really indicating a sense that you are confident that they will proceed through the stages. Help with goal setting, keeping in mind the slide we talked about before. And getting them to commit to a start date. Now, this can be with just yourself, or you can encourage them to make it public and talk to their relatives or friends about their commitment as well, if they're ready. And discussing any barriers that are important to them, and talking about how they might overcome some of those obstacles. Now, I'll talk about some typical barriers that people will indicate, and that's lack of time, energy, and motivation. So how do you talk about working around these kinds of barriers? So lack of time. Here, like we talked about before, you can talk about physical activity within lifestyle behaviors as opposed to scheduled events. And you can also talk, when it comes to nutrition, I wanted to mention as well, you can talk about the 10-minute rule. And what we mean by that is that you can receive health benefits of physical activity with just 10-minute bouts. So you can add these up throughout your day. Taking the stairs, walking to the store, gardening and housework, these will all add up if they're at least 10-minute bouts. And that's quite encouraging to people, because then they're not thinking in terms of scheduling these longer events. When it comes to healthy eating, you can talk about things that they can order at the fast food restaurant that they go to at work that might be a healthier option for them. You can talk about things they can pack with them, so it won't take a lot of their time making fancy meals, looking up recipes, and things like that. Lack of energy. This is something that people talk about a lot, and when I was talking about the long-term and short-term benefits, this is one that demonstrates this. Activity, we know, and healthy eating will improve your energy levels in the long term, but in the short term, they might not feel that energy. So talking to them about that dynamic can be important. You can also talk about the role of stress. We know that stress and anxiety fatigues the body, and of course healthy eating and physical activity does help reduce stress, which is part of the reason why these behaviors will increase your energy in the long term. This goes for pain as well. Often people with arthritis complain of pain when they're being physically active, but in fact physical activity over time will help reduce their pain. So that's a similar dynamic. The next barrier I wanted to talk about is interest and motivation. So they might not enjoy the health behavior. So here you can get them to talk about maybe foods that they do enjoy and activities that they find fun or they used to find fun. Talk about involving others to make it more enjoyable for them. So friends and families who are supportive of their health behavior. Help them consider some environmental factors like prompts or reminders that they can use on their fridge, for example. Something that I've personally used to motivate myself to get to the gym in the mornings is putting all my toiletries and makeup and that sort of thing at the locker at my gym, and that motivated me to get there before going to work because I wanted to put my deodorant on. And there's some other ideas for making things more fun in your guides. Okay, the last stage, those who are already engaging in the health behavior and might have been for some time, I am, keeping the pace. So here you would just help provide them and talk about strategies to help support continuing that health behavior and dealing with some barriers that come up and the inevitable relapses that often occurs when someone's trying to maintain a health behavior. And what's important here is to really normalize that experience, expect it, and plan for it. So here it's important for, as a therapist or as a counselor, to manage your own expectations about whether or not they're able to maintain that behavior for some time. Here you would expect that things will slip up. So important tips at this stage would be to highlight the benefits again, support their efforts by giving lots of praise and reinforcement about the important commitment that they've made and any changes that they've done already. Even asking them questions, well, how did you do it? Man, oh man, you went on a business trip and you were still able to get your walks in. How did you do it? Discuss a maintenance plan, so any foreseeable changes in their environment or their situation that might make it hard for them to engage in the behavior. So that might be company coming to their home, as an example. And of course, not only working on managing your own expectations, but helping them manage their expectations about relapse and slipping up at times, and really normalizing that experience again and just helping them come up with ideas to stay on track. And you could even share some personal experiences of how you've overcome some barriers. So the last slide here talks about the follow-up. So after making the follow-up appointment and you're meeting with them a second time, these are some things to keep in mind. And what I always try to do, whether it's formally or informally, get a sense of what stage of change they're at, because we do know these change over time. What their current behavior is like, that might have changed, and whether their goals have changed or not. And this is a time where you might want to tweak their goals to make it more realistic or to further challenge them. And of course, again, talking about the pros and cons. And this is an ongoing process. Over time, people start to learn about themselves and get a sense of what cons are important to them, what pros are important to them. So it's always important to keep that dialogue. Continuing helping them counter barriers. And the last point here is just to emphasize again that change is a process. There's a naturally cycling through some of the stages that can happen before that behavior becomes a habit. So it's important, when they come in for a second time and they might be feeling embarrassed or down on themselves that they weren't able to maintain that behavior, to really use that as a learning opportunity to gain more of a sense of themselves and how to keep it a habit. So thank you very much for having me again. I wish you all the luck and all the best of luck in your endeavors counseling others on physical activity and nutrition. I hope this has been a little bit helpful for you. Thanks.